How about sleeping difficulties and autism? Sometimes that could be going back again to that mood disruption. There's diet, there's nutrition, there are different things that can help with sleep. When we're talking about sleep disruptions and difficulties, we want to teach a child how to land their plane. So we say, think of an airplane in the sky. They don't just fly through the sky and then land, right? They have to like do all kinds of things. I don't know how long it takes them, but it takes them a while to get to the ground. So when we're talking about sleep, what kind of sleep routine do they have? Are they getting ready at 7 to put lights out by 7:30 or 8? Or are they go to bed at 8 o'clock and why aren't you asleep? And go to bed and go to bed and go to bed. It doesn't work that way. You have to land that plane, right? Get into some kind of routine. Is it bath, you know, pajamas, story? Is it prayer? Is it what do you do to get your body ready to go to bed? You're training your body. So don't forget that individuals that have autism are struggling with executive functioning. That's planning, that's taking care of their self-care, that's, you know, doing all kinds of things on a schedule or routine. So it really does make sense that they would struggle with their sleep because that's part of their self-care. That's part of getting into a routine. Sometimes the parents are struggling with that, and so their children are going to struggle with that. So talking to them about developing a sleep routine is very helpful. That also will take care of some of their mood when they're rested, right? Because all of us are going to be, I mean, for me, I know if I don't get my sleep, I'm going to be crappy, right? So get yourself on a routine. With executive functioning, I think that for the child that I brought up that graduated magna cum laude, academically very, very strong, executive functioning-wise, that was hard for him. And so if we can teach, when we know our children, because of the going back to that conversation about the school systems, when we talk about transition, when we get to 8th grade, they start wanting to help you get to high school, right? And then in high school, they're trying to get you ready for after graduation. We need to teach about that planning part because that's huge when they're done with school. We can't just be concerned with pure academics. We have to think about their life, their daily living, their ability to self-care and take care of themselves because they can graduate with the perfect grade point average. But can they take care of themselves when they're gone? Asking questions of the parents about are they having to support them to do their homework or check their grades and do all these things to help them keep their GPA, or are they self-driven doing this on their own? A lot of parents will say, oh no, I gotta be on them. I have to do this and I have to do that and I have to do this. Well, you can't do those things when they're off in college. Once they're gone, they're gone. And now it's up to them and they go from being wheelbarrowed through life to get off the wheelbarrow and walk. And that's hard. So executive functioning is very, very important. Part of that executive functioning is nutrition, and I do think that everybody does have different opinions about their GI tract, but most of our kiddos that are on the spectrum have experienced some type of gastrointestinal types of, that's probably another soft sign. They struggle with constipation or diarrhea or irregularities or allergies to certain foods, things like that. You know, there's some controversy about gluten-free and that's more harmful than good, and you know, it's just different things. I've seen some families where they swear by it and they're like, it's wonderful, you know, we can't eat gluten and everything's gone, everything's fine. And some are like, I've been doing this forever, I'm just driving myself crazy and it's not changing anything. So it really just depends. Every child, every body has a different reaction to things. But I do think that it could be very important, as with any child in development, whether you're having too much sugar, things like that. Diet is very important, self-care is very important. So the question says, does nutrition play a part in causing autism? I don't think that poor nutrition or any specific kind of nutrition would cause autism, but I think it can help improve some different variances. Just a little family secret, in my home, we keep our desserts for the weekend. So it's like, okay, well, you know, it's Friday, I'm gonna do some brownies, we're gonna watch a movie, that kind of thing. There are some children that are just like ice cream every day and cupcakes and candy and Cheetos and whatever. It depends on who you are. It's your home, you get to set the rules and all those things. I'll tell parents, because they'll complain about their child's diet. It's like, who's doing the shopping? Children aren't getting in their car and going to H-E-B on their own. You're doing the shopping. So you have to take the ownership of saying, you know, this is what I want my children to eat. I'm gonna eat this and model it for them or give them these options. And if they don't eat it, that's okay, but it's there in the home and you've done your part, right? So tricky, but you also have to lead by example. So I don't think that nutrition can cause autism, but I certainly think it can help you feel better if you're eating better, and that in itself can help you alleviate some of the symptoms. Does a stressful home increase the symptoms? I think if you are living in a home where there's no flexibility and there's a lot of rigid parenting and even harsh parenting, I've seen where there are symptoms that are escalated to violence because of that, but I've seen that even separate and apart from autism. I think most of y'all would agree that that's not a healthy environment to live in. But certainly for children on the spectrum and even more moderate to higher levels of autism, that could be extremely detrimental. That's why we do in-home services. We have ABA professionals that can go in and help, channel the structures and set up some routines. I think that most parents are doing the best they can with what they have and what they know, and that a lot of them need training and education. So we do a very systematic way of providing that. And if you're a therapist, I would highly recommend you include what we call parent sessions in your treatment. We see our kiddos 4 sessions, and then at the 4th session, at the end of that, we do a family session or a parent session. Sometimes we involve the children in that parent session, or sometimes we just have parent session. We're not compromising any of the confidentiality or privacy, but we're arming parents with strategies and tools, and we also want feedback on how they're progressing in their treatment. So involve them as much as you can. They need support. I feel like I'm doing a lot of talking, trying to get all this information in for you guys. I hope that today has been very helpful. I could go on and on about transitional planning and treatment and all kinds of different skills and strategies, but I feel like that would be a whole different topic. So I want to thank you for letting me come out today. I know that we've got done a little bit earlier, but I would be happy to stay here longer if anybody wants to talk or ask questions or share ideas. Especially with the schools. I love working with the community and being able to create change and improvement on our end, on their end, all kinds of things. I think we're working together for a common goal. You had your hand up.
My son was recently diagnosed, like in the past 2 months. He's 17, maybe 18. Northside Independent School District, when he was in elementary school, did assess him for autism, and they said he didn't have anything. And then everybody knows that show Parenthood. So we kind of as a family said he has a lot of what the character has. So we started with SAGE counseling last year, and then he just got diagnosed with Dr. Salazar. And she said, yes, he does, but why wasn't it found earlier, right? And he's like, I'm still using the term Asperger's. And she's told me, she goes, you're going to have some doctors that just say he's a higher functioning autism, and you're going to still have doctors that say Asperger's. So, yeah. But why wasn't he diagnosed?
I love that question because that's why I'm here. I want to spark that conversation and spark the research and people wanting to answer those questions for themselves. I have an opinion about it, but it is just an opinion because everybody has an opinion and we have a right to our opinion, so I'll share mine since you asked. I think that one of those trainers gave me the best phrase, and I wish I remembered her name. I don't, I apologize. But she said, when we were doing assessment training, she said to please remember, we call certain tests the gold standard. We say that when we're trained to do diagnostics. She said, I hate that. I don't want people to look at an assessment as a gold standard. She said, you are the gold standard. You as the person that's going to test, that result is only as good as the person that's testing. And so every individual, and again, I go back to we need a consistent playing field to be able to say, if I test them, I'm going to get the same thing. If you test them, you're going to get the same thing. If this physician tests them, they're going to get the same thing. We shouldn't be afraid to say, I don't know how to test this. Let me send you here, right? We give our clients 3 different options. Of course, we're able to test. We refer them to their campuses. We refer them to their doctors. We don't say this is the only place. But we need some consistency because we don't want to hear that.
I am a school psychologist, and one of the things I think that people, not to defend or have any, like, I clearly didn't test your kids, so.
Well, he's always had,
one of the things I think
is
is interesting to keep in mind is that unlike medical professionals, my job is to see if you have any diagnoses that prevent you from being able to get social studies instruction out of Mr. Jones. So it's quite possible that any one student could have any characteristics of ADHD or ODD, but let's say their obsessive compulsive disorder means that they have to put their name in the top of the paper. Their disorder actually makes them a better student and would not be something that would trigger an eligibility through my people. Having said that, they have to put their name on every paper. So a medical practitioner may actually say there is a diagnosis where, even though we're talking about the exact same child, I'm talking about educational need. And so it's quite possible that, you know, it was there the whole, I mean, you know probably better than any of your doctors or any of the people that you've ever worked with in the schools.
He was a late talker. He's always received child development, speech therapy, because he didn't start talking until he was 3. I mean, I would have thought that those would have been the clues early on, and the test would have shown it. But, I mean...
And I think that the concerning part for me, I'm a school counselor, I'm a certified teacher, I've been in that realm, is when we're in a school setting, we are mostly concerned, and please correct me on the different viewpoint, but we are mostly concerned with the educational need because that's where they're at school, and that's what we're determining. If they can function well in some of these magna cum laude, I mean, what can we do for them? Nothing. The concerning part on the outside in the private sector for me is that I get them after they're done with school and they're not in a good place. That's the part that bothers me. As a mother and as a professional, what can we be doing while they're in school to identify their need? And if it's not something the school can do to treatment or anything, they can refer, and they should refer and say, you know, I think maybe here at school he's doing okay. I mean, he's doing fine, and in some cases beyond. But I'm hearing that he's struggling at home. I'm hearing that there's, you know, social issues. I'm hearing all those things. He needs to work on that to help him prepare for life. But it's not something we can necessarily do here because he's doing okay here. We have to take a closer look to see if they're struggling in some of those ways, because even academically, if they're not struggling in that method, but they're sitting alone on the playground crying, they're struggling in that aspect. So
that is also part of our eligibility. Yes. Education in schools and whether or not our kid actually has special needs in any way, shape, or form is not, you know, when I say get the information out of Mr. Jones, I mean, is he sitting, just like you said, by himself? He's not interacting in any of the group work. Is he, you know, able to actually get through the lunchroom functionally? Is he able to get through the hallways without, you know, causing some sort of disruption, either by isolating himself or by interacting inappropriately? So, I mean, education is a big thing. But like you said, once what the focus of any of the diagnosis that we would even broach is not even considered diagnosis, it's considered eligibility. How much, what do I have to change to even benefit from school? But you're right, I mean, the second that they leave our doors, it's like, there's, what can we do? You know, we've got our own messes at home that we've got to go clean up too. So.
yeah. So one of the things I'm wanting from your story, which is a very, very common story, it saddens me, but it's reality. A couple of months ago, I had a parent call and said, I left a psychologist's office and they said, your child is on the spectrum, but there's nothing we can do. And I was shocked. You heard that from a professional. It's okay to say, there's nothing I can do, but nothing we can do, because there are people who can do something about that. And then just as a mother, it hurt me, you know.
Before he graduated in 2 years, and to see what help he would be able to get from Alamo College. But I have one more question. I'm a case manager and I help other patients, and only one of my patients had recently mentioned that they had to go to court when their child turned 18. Is that something that I have to do to become his legal guardian?
That's a choice option you have. There's a lot of different resources, and families are suggested. In fact, if Beth wants to make a copy, we can leave this with you. But we have, very similar to the districts are so good about giving resources and things like that. It's an option for parents. I would recommend, if your child cannot make decisions on their own, especially decisions that are going to involve money, you know, medications, if they're on medications and they don't know how to have conversations with their physicians about dosages and why am I taking this and is this helpful, or I don't want to take that anymore, you know, being able to take care of their executive, depending on the IQ levels, different things will play into that decision. We talk about whether or not they want to receive that guardianship, legal guardianship. When we're talking about SSI and things like that, it just depends how sustainable your child is. There are a lot of children that are on the cusp. They're not lower functioning, they're not higher functioning, they're like, you know, I can get a job, but I don't know how long I'll keep it, but I don't need support because I can get it on my own. And I'm not like that. I mean, they'll look and, you know, they feel like, no, that's not me. So it just really depends, but there are, you know, that's where I would say have your child and yourself get some advice from a professional, because it's not a clear-cut answer.
Yeah, we just don't know yet. Like all this is new, and she says that we need to test his anxiety. So she wants him to get a job.
I think
Because that's the only way we're gonna know.
well, you know, that.
Like I don't know what to ask. I don't even know what to. Sorry.
When we talk about our individuals and even our clients, our children, our own children, those things, we know where they are. We always want to hold the bar here. We don't want to hold the bar here just because they have a need and they need us and to help them. We want to hold the bar just above. We don't want a gap. We don't want them to say, I can't do that, right? But you want to do this every year. So if they're at that age where they're going to start a job or even drive, those kinds of things, you want to find out where they are and just hold the bar here. Maybe they need to volunteer before they get a job. Maybe they need to work with Texas Work Commission. You know, they need something, but they shouldn't say they're not going to ever have a job. You know, it's going to happen when you go off to the heavens and your child's here left alone. You know, you got to get them prepared. And it's never too early, ever.